Patient safety. Hypoglycemia help for patients during routine visits with providers. It's important to mention hypoglycemia to patients on most non-insulin anti-hyperglycemic therapies as well as insulin. A recent prospective study demonstrated that the majority of patients with diabetes requiring hospitalization for severe hypoglycemia were those with type 2 diabetes. There was a strong association between severe hypoglycemia and combined metformin and sulfonylurea therapy. So hypoglycemia, it's dangerous, dreaded by patients, and we need patient explanations. It's a legal mandate that we do this. You just can't say, I told insulin or I told them to go on insulin, but it's never mentioned. And then you document that you talked about it. That's important. So there is the good old rule of 15 grams of carb, about 15, and about 15 minutes to feel close to normal. So that could be in 1/2 cup or so of any fruit juice or regular non-diet soda. It doesn't have to be orange, it doesn't have to be clear, any kind of fruit juice or non-diet soda. You can use a tablespoon of sugar, honey, jelly, cake icing. You can use 4 glucose tablets, very portable, 1 tube glucose gel, or about 15 grams of a known amount of an easily swallowed candy. So it wouldn't just be any old candy, but you would know what's in a little packet of sweeties or sweet tarts. This is often used for children. Follow-up treatment if greater than an hour until the next meal. But some common treatments we hear of are not good practice. So let's look at some of these. Hard candy. Well, geez, not that fast. Effective. You suck on it for 10 minutes. I had a patient break a tooth. There have been reports of patients choking when they try to swallow it. I suppose you use it if there's nothing else available, but as it says at the bottom, be prepared with ready-to-go and effective treatment. How much is in any little piece of hard candy? So the second, chocolate candy bar, not that fast, effective. Well, yes, but not soon, because it contains other components that slow down the carb action, the fats, the nuts, and so on. Again, if you weren't prepared and that was there, yes. Ice cream would be the same, as would peanut butter and crackers. They have other components that don't let them work all that fast. Diet soda, no. Lie down and rest, no. Over-treating with large amounts of food and fluids is a very common problem. So hypoglycemia symptoms can include extreme hunger, shaking, confusion. And past experience of the patient demonstrated that he felt better after treating with carbs, like way too many carbs. Acknowledge that it's understandable why people overtreat, but explain that the correct number of carbs will bring up the blood sugar as fast as too many carbs. More carbs do not work faster. The appropriate amount brings it up, and all the extra just drives it super high. Overtreatment only drives sugar very high and makes everything worse. Low, high, and so on, which makes you feel worse. It can throw you out of whack. Treated normally and hypoglycemic can make all numbers the next 24 hours the suspect, but certainly with very high treatment. And forming a better habit for treatment is not easy, but it can be done. Give it a try. We do want to know that this is important. If you think your sugar is low, test and treat. If your meter is not available, go ahead and treat. Low blood sugar removes energy from the brain and thinking suffers. Patients have been known to skip treatment because they were not near the meter with catastrophic results. And if you're not low, the correct treatment will not raise blood glucose dangerously. Better to treat if think low, but if this situation happens again, be sure that your meter is with you for the time being to find out what's going on. Now for some type 1s, we do teach, been known to teach glucose emergency kit. It can be lifesaver. It's not user-friendly because it needs to be reconstituted, so you need to practice with an expired one. There's many reports of someone with their loved one seizing, and at that point, reading all that information on that little thin piece of paper and trying to reconstitute, it doesn't work well at all. So if you were to describe to your spouse, this is talking to a patient, what we talked about today about low blood sugar, what would you say? Teach back is more productive than got any questions. Thank you.